So I'm from the New London Homeless Hospitality Center, and our focus is single adults who are experiencing homelessness. And we have an emergency shelter and some housing program and permanent supportive housing and a variety of different things that we do. We're also landlords. We have a fair amount of affordable housing. And I would say the other thing, and I realize this more now than I did even before, is that we're also a resource for a lot of people in New London and the surrounding areas who sort of go in and out of close to homelessness, then just hanging on by their fingernails. And just we are, and I'm proud of this, and I want to get back to this. We're really a place where people feel they can come, and we're not just creating a queue and you have to go jump through 100 hoops. I really, even if it's just to come and have a cup of coffee. So there's a lot of different things that we do, and we have a help center just to assist people. We have computers because a lot of people, especially now, have no access to the internet. So I think we're really just trying to be a resource for people who are experiencing homelessness at the moment, but also for the very many very poor people who are constantly teetering on the edge of homelessness. Essentially, the things that we did is that we, in partnership with our Department of Public Health, we really quickly understood the key things we had to do: clean more, social distancing, and probably most successfully, actually, we also realized that we needed a way to isolate people who became sick. And one of the things that is particularly frightening about COVID-19 as it unfolded is that it's not, at first we thought, oh, we're going to have a thermometer, we're going to check your temperature. If you have a fever, you may be sick. And it turned out to be so much more complicated than that. But working with the Community Health Center, which is one of our partners, working with the visiting nurses of Southeastern Connecticut, working with our health department, we developed, I think, a really good screening tool. And our staff has been absolutely fantastic. It's not easy to talk to people one on one, take their temperatures, talk to them about their health. But we really were able to do that and connect to people, to identify people who could be experiencing symptoms. And then again, partnerships. That's the whole thing that comes to mind for me. Is this is really about relationships and partnerships. So the City of New London and the fire chief located a building for us. And it's a former nursing home. So there's 15 individual rooms, each with their own bathroom. I knew that the YMCA in our region had laid off quite a bit of their staff, or furloughed a lot of their staff. Through their personnel department, we reached out to the people who had been working at the Y. The city opened the site. The visiting nurses sent a nurse down there. L&M Hospital coordinated testing with us. And we had an absolutely unbelievable isolation site. And this is so important, right? If you have a congregate shelter and you have people who need to isolate, to say that is one thing. To make it happen is something else. And we could never have done it by ourselves.